In this video, we'll talk about lichen sclerosus, or LS for short, which in males is known as balanitis xerotica obliterans, or BXO. This is a fancy name, which means that this is an irritation of the head of the penis, which dries things out and obliterates the area, meaning actually causes physical destruction of the tissue over the area. Lichen sclerosus is a chronic condition of unknown origin, meaning we're not really sure what the causes are, but the bottom line of the condition is that it causes some form of chronic irritation, meaning redness and itch and other symptoms of irritation over the affected area, which is most commonly the privates in the perianal area. And eventually that redness and irritation leads to plaques or areas that are firm, meaning they're tough or rubbery against your fingers when you actually try and feel them out and palpate them. And the surface of those pretty firm plaques is ivory white, meaning the surface of the affected area looks white and shiny, sort of like porcelain white. And that is a very distinct hallmark of lichen sclerosus. There's another condition that can look a little bit like it, which is called morphea. They're in the same category of conditions that cause scarring or thickening of the skin where they're affecting the body. And lichen sclerosus in particular, like I said, has a predilection or has an association with the genitals in both males and females and can affect the perianal area. Now, what is the problem with lichen sclerosus besides being unsightly and irritating and itchy and burning and all of the above, which are not nothing? They're actually very, very disruptive to people's quality of life when there's a chronic itch over the privates or the perianal area. But the other issue with lichen sclerosus is that it can actually lead to functional issues and to destruction of certain parts of the genitals. In males, it can lead to destruction of the head of the penis and impotence and some issues in urination. In females, it can lead to sexual dysfunction. It can actually lead to the obliteration of portions of the vulva, including the labia minora, portions of the labia majora, the clitoris, and it can actually cause narrowing of the introitus, meaning the opening to the vagina, causing significant issues in both sexual function and other issues as well, and it can lead to difficulty in urination and trouble in that area. Another issue that's associated with lichen sclerosus, besides all of the chronic symptoms, all the irritation, and the destruction of the affected areas, is that it can lead to development of cancer over the affected area, particularly in females. In males, the association has not been that well defined, but areas that are affected with lichen sclerosus, we're talking about the genitals in females, have a higher risk of transitioning to squamous cell carcinoma, which is a very, very serious cancer to have. And that form of cancer can show over the affected areas as areas or sores that are not healing properly after weeks or months of waiting for the thing to heal. Sometimes those cancers can show up as pimples, painful pimples that are not healing well. And at any rate, that causes a major, major headache for anybody who's affected with this condition. Now, this condition must be managed. It affects both men and women, mostly affecting women, by the way. And there's another subset of the population that is affected by this, and that is prepubescent girls, meaning girls before their puberty, before they hit puberty, can actually develop lichen sclerosus over the privates. And that unfortunately gets mistaken many times for other conditions. It gets mistaken for eczema, it gets mistaken for candidiasis or infection, and it gets mistreated as such, missing the diagnosis, and that can actually lead to serious problems down the road. So the awareness of this condition, the awareness amongst the population, generally everybody, everyday people, in addition to clinicians, pediatricians, OB-GYN, urologists, and obviously dermatologists, is extremely important so we can spot this condition early, follow up on it, treat it decidedly as it needs to be treated, as I'll go over in a moment. And and then follow up consistently to make sure that the condition does not raise its ugly head again, causing more chaos and mayhem over the area, more headache for the patient, and additionally decreasing the risk, or at least catching development of cancer over the area early, which is very important, could be life-saving. And by the way, definitely life-saving as far as the quality of life that can be saved by catching this condition early and treating it early. So this is an exceptionally important condition to be aware of, to catch early, manage decidedly, follow up on consistently, and make sure nobody slips through the cracks so we can actually follow up accordingly and make sure that everybody's all right at the end of this. All right. So what is the management of lichen sclerosis? Lichen sclerosis needs to be managed as you would manage eczema of the area or irritation of the area, but there are some emphases, or there are some hallmarks of the treatment that stray from eczema that are a little bit more long-term, a little bit more aggressive than you would treat your average eczema of the area, or average vulvitis or balanitis of the area in the professional terminology. So first of all, as you know, I usually tend to recommend what not to do first, because what not to do actually is very important, as things can make lichen sclerosis worse. The wrong stuff done over the area can actually make your condition worse and make it more chronic, make it more persistent, and undermine the success of the treatment that you're trying to employ to knock this condition out and reverse some of the effects that it caused over the area. So very importantly, avoid things that can irritate the skin over the area. That means avoid hot water above 104, 105 degrees Fahrenheit, around 40 degrees centigrade. Do not go that high. Go to lukewarm. You can use cool water as well. Avoid detergents and cleansers and soaps over the area. And I'm talking about the head of the penis or the vulva itself, as that can lead to further irritation. The area that's affected is already worked up. It's already trying to defend itself by making as much secretions over the area as possible. And by treating the area with a detergent or with soap or with a cleanser or any such chemical cleansing product, you're actually obliterating the very bare minimum that the area is trying to produce to protect itself. You're putting it at a further deficit. You're making it more sensitive. You're making it more irritable. You're actually setting yourself back. So don't do it. Don't scrub the area as well. Don't use any physical abrasives over the area. That can really knock you back. It can make the area worse. It can actually further worsen the irritation over the area. So all those practices that seem like a very good idea, especially instinctively to a lot of people, they think that when the skin is red or it's itchy or it burns, there's an infection going on, where in fact with lichen sclerosis there's no infection going on. There is, however, severe irritation of the area that can lead to severe consequences, and that needs to be mitigated, meaning not to make it any worse initially, and then go ahead and actually treat it so it becomes better. Now, what's the next step? So you want to avoid all the irritating practices. Avoid, by the way, disinfection of the area with alcohol, hydrogen peroxide, unless there's a clear indication that was discussed between you and your physician for disinfection. Do not disinfect the area automatically. Don't use baby wipes or wet wipes over the area. That can further irritate the area. That can actually lead to contact dermatitis on top of the lichen sclerosis. Those two can overlap. There's nothing preventing them from overlapping. If you'll work at it hard enough, you'll actually make the area irritated, both from the allergic or the irritant point of view and from the lichen sclerosis point of view. That could be a major whammy put together and a major blow to the area. Another thing to avoid is avoid automatic use of antifungal creams and antibacterial topicals. These do have their place in treating certain conditions which sometimes are associated with lichen sclerosis, however, not automatically. So there must be a rhyme and a reason for using any product over the area. So do not use things perfunctorily or automatically over the area. Do yourself a favor, check every product you use over the area check with your dermatologist or with your OB-GYN or urologist. Make sure that there's a rhyme or reason, there's actual purpose for using any one of these products over the area. So don't do yourself in that way. Don't actually undermine your own skincare. So first of all, do no harm, right? what can you do to actually help the area and soothe the area? Well, very importantly, lukewarm water, like I said, washing the area, well, semi-regularly would be fine. The other thing to remember is that the area is exceptionally dry when it has lichen sclerosis. That means that you would benefit from moisturizing the affected areas, especially if they feel dry, especially if they feel irritated, meaning they burn or they itch or they hurt. That would help tremendously because the skin is not able to protect itself by producing elements and holding onto them that would form that barrier over the skin or over the mucosal surface. And that means that that's on you. That's on you to actually apply those medications or those moisturizers, topicals, on top of the skin and form that barrier for the skin to help the skin catch up, or at least give the skin some reprieve. The best moisturizers that I recommend, as you know, are the occlusive class. I like petroleum jelly. I like my creamy Carnauba moisturizing balm, which is made with shea butter, Carnauba wax, and sunflower oil. Very minimalistically formulated product. Do not go fancy, meaning don't go with anything that is $200 moisturizers. Don't go with anything that says anything fancy on the tube or on the packaging. You don't want to do any of that stuff. So don't use anything that says organic or natural or anything that's just a buzzword. Check the back of the package for the ingredient list. Make sure it's minimalistically compounded and formulated. So petroleum jelly works. My moisturizing balm works because it's made with 3 edible ingredients. If you're looking at anything beyond 3 or 5 ingredients, you're outdone yourself. You've basically gone beyond what is recommended to apply over the area. And I would actually not use Aquaphor or CeraVe products over the area as well. There's too many ingredients in those products for me to really trust them over the area, especially with a skin that's so worked up as skin or mucosal surfaces with lichen sclerosis. So don't do it. Keep it minimalistic. How do you apply the occlusive class on the area? Any occlusive product, or any product for that matter, use a pinhead size amount or a drop size amount over the entire area so you don't end up with any greasy residue that'll stain your underwear, that'll stain other fabric or other inanimate objects. Don't use any of that stuff excessively. Use it exactly as needed, applying exactly as much as you need to, and then leave it alone. How often do you moisturize the area? Well, as often as the area feels irritated or looks dry. There's really no limitation to it. There's no real recipe to follow here except for just follow how the area looks and feels. And that is something to keep in mind. Sometimes the area would feel irritated the entire day. Sometimes there's a little break that you can take. The area takes for you, and that will decrease the number of applications that you would be required to apply over the area. Alright, so moisturization and protection of the area are very important. Now, those of you who are sexually active, very important as well. Don't use KY jelly over the area or water-based solutions or gels because they can actually form an irritation over the area as well. I also recommend using, again, the occlusive class as lubricants. The area does become dry with lichen sclerosis. It's very difficult to have sex for many of the people afflicted with this condition, both men and women, by the way. But with women, there's a need for lubrication. Do not use KY jelly. Do not use any of the water-based gels or solutions, as they can actually irritate the skin. They can be extra irritating to the skin. You can use occlusives and vegetable-based oils. So you can use petroleum jelly. You can use my creamy Carnauba moisturizing balm. You can use coconut oil. You can use sunflower oil, and sometimes shea butter. Although shea butter can actually, on its own, can be a little grainy, and that can form a physical abrasive element over the area. So be very mindful with the oils you're applying over the area as well. You want to be very conscious of that. All right, now let's talk about actual active treatment. With all our development and our technological advancements over the past few decades, the gold standard of treatment for lichen sclerosis has remained the same, and that is high-potency topical steroid application to the area. And the application needs to be pretty persistent, and it's long-term, meaning it could take sometimes weeks and sometimes even long months to get things under control. And that's where it actually gets very, very tricky, and a lot of nuance is required for you and for your dermatologist or whoever else is managing the condition with you, your OB-GYN or your urologist, to actually make sure that you're applying it for the right amount of time without incurring side effects or without going overboard with the treatment, and obviously checking for any side effects that are peripheral to the application of the steroids. Now, what are we looking for to accomplish with the application of topical steroids? Well, we're looking to actually thin down the affected skin. Now it sounds almost crazy because steroids, one of the major side effects of steroids topically applied and even systemically taken is that they cause skin atrophy, meaning they cause a decrease in some of the elements of the skin that makes the skin nice and plump and actually bouncy. And specifically, they decrease collagen content in the skin. They can cause decrease in other elements, and that's what steroids do. Now, why would we want the steroids to be applied over the area long term? The reason is lichen sclerosis causes thickening of the skin over the affected areas that it takes over. And that means that those areas are actually pathologically thicker than the surrounding skin or the surrounding mucosa. That means that those areas, the desired effect that you're looking to accomplish with the steroids, besides decrease in inflammation and irritation, which takes care of some of the symptoms, and sometimes some of the ability or the tendency for the condition to recur, that could actually cause also thinning down of those areas in what I call pseudo-normalization, meaning the area becomes a little bit more bouncy as far as the texture of the skin is concerned, a little bit more flexible than it used to be under lichen sclerosis, which causes firming and hardening of the skin, almost like a scar. So that thins down that scar tissue that lichen sclerosis forms, and that gives you a temporary reprieve. The condition is not curable, meaning you can't get away from it forever, but you can definitely decrease that thickening of the mucosal area and thickening of the skin that's associated with lichen sclerosis with persistent treatment with a high-potency topical steroid, and then you need to back away from that. Once you've gotten to that pseudo-normal sensation over the area where it looks and feels almost completely normal, it's not going to be normal completely, but you will get some of the normal appearance back. Then it's time to start backing away from the treatment and go into what we call maintenance treatment. And that again requires some nuance on your part in coordination with your dermatologist or your OB/GYN or urologist. That being said, that could be achieved, and everybody's a little different. That's why I don't want to give any specific recommendations here. But let's just say that induction period where you're actually getting things under control, you're pedal to the metal, you're treating twice a day with the high potency topical steroid, you're going to get things down to the point where it looks or it feels normal, and then you're going to back away from the treatment and you're going to do what we call maintenance, which is to maintain what you got. You maintain the remission or the almost remission that you got of the condition, and you're going to relax and still treat the area, as I said earlier, without undermining the skin in any way, shape, or form. So not doing anything abrasive, not going after the area any harder than you were before. But you can actually relax the treatment. So that is sort of the seesaw or the yin and yang of treatment long term with a topical cortisone, topical steroid. There are other optional treatments for lichen sclerosis. They're not as effective and certainly not viable long term for lichen sclerosis. So first of all, there are alternative medications like calcineurin inhibitors that can decrease the level of inflammation. They don't cause the thinning of the skin, which topical steroids do as a side effect almost, but in this case it's actually a desired side effect to a certain point. Calcineurin inhibitors don't do that. Those are another category of prescription medications. They're not steroidal. And then there are new medications or new modalities of treatment that can be applied to lichen sclerosis that are less well researched but are showing promise. Specifically, platelet-rich plasma injections to the area, which is a technique where your own platelets and plasma get concentrated, and what we do with that product, with that concentrate, is we inject it to the area, and that has shown promise in certain sets of patients. In certain cases, people report great relief and actual remission is achieved with the centrifuge product that's injected to the area. So platelet-rich plasma, or PRP, is one product that is showing promise in a limited group of patients. Another modality of treatment is laser. Certain types of laser can actually especially the resurfacing kinds, can actually change the properties of the skin, at least temporarily, over the area, leading to some remission or some improvement in the symptoms. And an ultrasound treatment can also lead to some improvement in the symptoms as well. There's still much research to be done over the area. There's other treatments in the background that I'm not going to mention because this is way too much and those treatments are not that well founded. But there is research going to treatment of lichen sclerosus, and hopefully we'll come up with something, hopefully a cure even one of those days. Not too optimistic about a cure anytime soon, but maybe we will come up with something that's going to give us a longer term remission with leaving you alone and actually saving you some money and heartache and allowing you to live your life. Alright, well, thanks so much for watching this video. Please hit the like and subscribe button for some more awesome content from this channel. Really appreciate your support. I'll see you on the next one, and God bless.
Ryan Little.